Verify the healthcare provider's orders. I'm going to gather my necessary equipment and supplies. I'm going to perform hand hygiene and provide my patient and her loved one with patient privacy. I'm going to introduce myself to the patient. Hi, my name is Jake Nichols. I'm going to be your student nurse today. What is your name?
Brenda Nichols.
And when is your birthday?
4/28/73.
I'm going to verify this on your wristband. And who do you have here with you today?
My great niece.
Hi, nice to meet you. So today I'm going to be assessing peripheral vascular system, head and neck vessels. Is that okay with you today?
Yes.
Perfect. I'm going to examine your peripheral veins. I'm looking for any swelling, varicose veins, any skin changes, and I'm not seeing anything that's abnormal. Okay, now I'm going to measure the jugular venous pressure in 5 steps. I'm going to go ahead and place the patient supine until the jugular veins are engorged. So I'm going to have you lay flat on your back. Okay. Go ahead and place your head down. Okay, I'm going to go ahead and inspect the jugular vein. I'm going to raise the head of the bed until you can see the jugular vein pulsations between the angle of the jaw and the clavicle. Okay, go ahead and sit up. You can sit back, please. Okay, now I'm going to hold a ruler vertically on the mid-axillary line and horizontally to measure the jugular venous pulsations. And it is going to be 7 centimeters. I'm going to confirm JVP and I'm going to assess the hepatojugular reflex in 3 steps. I'm going to put pressure on the patient's abdomen and ask them to breathe normally while assessing JVP. Perfect. An assessment on your peripheral arteries. I'm going to go ahead and do a physical examination. Is that okay?
Yep.
I'm going to start with your carotid pulse. Okay. Do your brachial pulse. Do your radial pulse. So I'm going to do your femoral pulse. Okay. Okay, now I'm going to do your popliteal pulse. Just under your thigh here. And then straight your leg out. Okay, now I'm going to do your dorsalius pulse, your foot here. Now your posterior tibial pulse. Okay. Rate, rhythm, quality seem normal. There was no obstructions of blood flow. Now I'm using a stethoscope. I'm going to auscultate for bruits. I'm going to put my stethoscope in. I'm going to start with the carotid. I'm going to ask the patient to hold their breath so I can hear it easier. Okay. Clavian. Okay. Renal. Iliac. Abdominal aorta. Femoral. Ask them to hold their breath again. Okay, I was feeling for coolness, any stenosis, paler. I'm assessing collapsed superficial veins with delayed venous filling. Checking thin, atrophied skin, muscle atrophy. I'm gonna leave the patient with her call light. Do you have any concerns that you would want me to let your provider know?
No.
Okay, thank you. It was nice to meet you.